हाय फ्रेंड्स, गुड इवनिंग। आई एम डॉक्टर आशुतोष गुप्ता एंड फीटल की जो स्पाइन है उसकी प्रॉब्लम सबसे वन ऑफ द कॉमनेस्ट सिस्टम्स है जिसमें कंजेनिटल एबनॉर्मलिटी हो सकती है। और जो फीटस है, जो एग्जामिनेशन ऑफ द बेबी होता है, वो एक तरह का सवाल है, एक तरह का क्वेश्चन पेपर है इन विच द बेबी इज क्वेश्चनिंग द एग्जामिनर और द अल्ट्रासोनोलॉजिस्ट और द फीटल मेडिसिन स्पेशलिस्ट whosoever is doing the ultrasounds. So there are different questions being asked by the baby and you need to have slight amount of an luck on your side apart from being dexterous. Yeah, whatever the knowledge or the background, whatever it is that you might be having, but luck has to be on your side so as to pick them up very aptly. So this is one case in which we have identified a diastematomyelia. We could delineate the split spinal cord, and then we can identify a syrinx in one case. And we were very lucky enough that the baby was absolutely conducive in making us see and understand the whole scenario and the anatomy. So let us see these slides and then we'll talk about. So look carefully. This is what we are doing. So our two bony spurs and diastematomyelia, and we just saw the split. So this is the split cord and getting split with this diastematomyelia, and then we can identify, delineate the syrinx going on and below, and variable amount of so this is the cord, diastematomyelia, split cord, right, and the syrinx, and variable amount of an caudal regression, right, and segmentation defects in the lower spinal cord. Then again we are delineating and the baby is very very comfortable and conducive so as to showing us absolutely the defect. So and then this is the various numerous segmentation defects. This is what we are seeing is from the below, right? So we can see the syrinx very well. So this is the fusiform dilatation of uh, the cord. So this is the syrinx here, right? And then we are going from below. So that is what it is, and we can, so this is the syrinx here. So that is how it is. So we saw the two bony spurs, and therefore which was there in the middle of the lower lumbar in the sacral vertebrae, and therefore the cord was getting split. So the split cord could be delineated very well, and we can identify the syrinx just below this bony spurs. We have had multiple of 3, 4 vertebral segmentation defects, and therefore there could be part of the variable caudal regression syndrome. And we try to look around whether there was any issues. The amniotic fluid was slightly on the higher side, and the baby was keeping the legs extended, and but we could see the flexion, but eventually the baby was in a in slightly extended position for both the hip joint as well as the knee joint. So they were slightly. So there are a lot of things to talk about whenever we talk about diastematomyelia and split cord. So there could be some issues regarding the bladder bowel dysfunction, and the baby might need sort of a teething of that particular cord, and therefore to free the cord from that sort of a tie which is there at the level of the diastematomyelia. And then also we can have some bladder and bowel dysfunction. So the huge counseling is required later on post the ultrasound. But only thing is this, that this is sort of an unusual that we could see the all these things together, diastematomyelia leading to split cord and the syrinx, right? Thank you very much for your patience.